Okay, well, Ramon does make some valid points there. He's constantly talking about diagnosing and die, sending him to hospitals to be killed. Well, there's one word that we used in our proposition that's key here: voluntary. It is completely up to the patient to decide whether they want to go through with euthanasia or not. And furthermore, Eric G. Cassell, clinical professor of the public of health, states, when terminally ill patients request assistance in dying because of their suffering, and their request meets commonly endorsed safeguards, their request should be honored. Those who disagree, in which case the physicians who don't want to go through it, should feel no compulsion to give aid in dying. Meaning physicians who feel that it's unethical and don't want to do it don't have to. It is a voluntary choice, and it's not being forced on anyone. Now, a key figure in euthanasia is a Dr. Jack Kevorkian, a 70-year-old retired pathologist who devoted most of his life for assisted suicide. He has admitted to helping more than 130 people end their lives. Now think about that. 130 people. That's a lot of cases. And yet the opponents only bring up the one case of a woman who was only diagnosed by one. So what happened to the other 129? Anyway, and would legalizing euthanasia destroy the patient trust with the doctor? Overall, 3 times as many people disagree as agree that legalizing physician-assisted death would cause them to trust their personal doctors less. Now, living wills, another part of euthanasia. These patients have to go through all these safeguards, and they have to meet certain conditions. And if they are unable to assist with the suicide themselves, or they have unbearable pain, as one of our main points, unbearable pain, they can't do anything right, and they're dying, then they should be allowed to end their suffering. So, and part of that is living wills. People decide beforehand, living relatives or friends can decide to help their decision. So basically, would euthanasia be wrong? No. True that suicide is not really the best way to solve a problem, but like I said, it's completely voluntary for the people who want to go through with it. If they don't want to go through with it, then they don't have to.
All right. Thank you.